It's 2:00. I'm Olive Martini, and lucky you, it is the Working on Wellness Forum. And today my guest is Dr. Nathan Gelder, DMD, and we'll be talking about teeth today. Dr. Gelder always strives to achieve the highest level of care and takes time to make sure his patients are comfortable and well-informed. In this forum, Dr. Gelder will discuss the kinds of care now available in today's world of dentistry. He'll answer the most asked questions about current oral care and address the most common problems and concerns of today's dental patients. Welcome, Dr. Gelder.
Thank you. Nice to be here.
Oh, well, it's wonderful to have you. Dr. Gelder is my dentist, by the way. And what we'd like for you to do as you're listening, if you have any questions for Dr. Gelder, give us a call at 360-681-0000, and we will ask your question on the air. And maybe we can stump Dr. Gelder. I don't know. We'll give it a try. So let's start off. Tell us a little bit about your practice and how long you've been practicing here in Sequim.
Yeah, well, we are located on Sequim Avenue, just kind of near the First Federal Bank. And I've been here in town almost 20 years. And I started working with another doctor, Brian Juel, who started the office in the 90s. And then we kind of had a time where he kind of phased out for a few years and I phased in, and now it's just myself.
Okay, so you're very busy.
We are.
All right. Well, let's start off. Tell us what teeth are made of.
Well, I mean, ultimately, they're made of a whole combination of elements, calcium and phosphate and different, just on the periodic table. But then that combines to form enamel, which is the outer layer. And
if you lose enamel, it doesn't come back. Is that right?
No. You get what you get when the tooth's formed. And if it's gone, you're not going to get any back. And so that's the outer layer, and that's much harder, more wear resistant, more decay resistant, less sensitive. And then the inner layer is the dentin, which is, well, the opposite of all that. It's not as hard, and it's so, for instance, when teeth wear down for some reason, or you get a cavity and the enamel is compromised, the dentin is exposed. And that can make a tooth really sensitive because you're a lot closer to the nerve inside.
Okay.
Yeah.
Okay.
That's what teeth are made of.
So why are teeth different colors?
Well, I think, a lot of it is just, people's skin is different colors, right? So you got different amounts of pigment in your skin and in your teeth as well.
A dental hygienist said to me one time that your teeth have a grayish tone if you're a brunette and a yellow tone if you're blonde. Is that true?
I suppose it could be. I've never quite...
We don't know.
Never quite noticed that.
She probably made that up.
But if she said it with confidence, I guess it stuck. But then, of course, things can stain teeth as well.
Right.
And so, all kinds of dark-colored foods, liquids, tea, coffee, wine, all can stain teeth. Time can just teeth overall will get darker as we age too. And
what do you suggest to whiten teeth?
Well, the standard way of whitening is just with peroxide-based gels. Mm-hmm. And so the way we do it in our office is we make people custom-fitted trays. And then you put the gel in, and you wear it for about an hour at a time for a week or two, and it will definitely make teeth whiter.
Okay.
Yeah. Something to be mindful of, though, is if you have any fillings or crowns or restorations that are visible, those will not get whiter. So if you have some that match really well and you whiten, they might not match so well.
Okay. So a good suggestion would be before you get your teeth capped, whiten your teeth so that...
Yeah, well, exactly.
Then you got to stick with it,
Or if you're thinking about doing it, it might be worthwhile to stop by your dental office and ask if it would be appropriate.
Yeah. Do you do that Zoom thing where you put the ultraviolet light on? Do you do that?
We don't.
Okay. Why not?
We used to do a procedure similar to that, but it's a one-time deal.
Oh.
And no matter how you whiten your teeth, it's temporary.
Okay.
It will fade. And so by making people the trays where they can do it at home, then they can do it as much or as little as they want. And when they do fade, they can just go ahead and touch them up.
I know that once a year you do a discount on the gel. When's that coming up? I'd like to know.
I think it's usually
in June.
Maybe we've done it in the summer. I was wanting to say Christmas time. Maybe.
I don't remember that.
I think we've done both over the years.
Yeah? Okay. Well, I'll be watching. What we have a question from a listener. What's the major cause of a metallic taste? Is it related to fillings?
In general, whenever I see, and I come across this every now and then with metallic tastes, I think most of the time it's a neurological thing. Very rarely do I find it having anything to do with the teeth or anything in the mouth. But I think it's your brain, for one reason or another, is perceiving that metallic taste.
Well, let's talk about when you go into the dentist and they feel your neck. What are they feeling for? What are they looking for?
Just any sort of mass that's not there. Inflamed lymph nodes or, some kind of bump or
okay. And you can you can tell what kind of there might be disease present if you're doing a dental exam, and what is it that you're looking for there?
Oh, just when we're doing a standard dental exam? Well, we're looking for cavities. We're looking for broken teeth. We're looking for signs of gum disease.
Okay.
We're looking for anything just out of the ordinary. Again, a weird growth.
Okay.
Yeah, or like an ulcer, a sore. Yeah, just anything that's kind of out of place and is not supposed to be there. Yeah.
What is fluoride, and what has it done to improve our teeth?
Well, fluoride, like we were just talking about, the chemicals that make up teeth, is an element. It's one of the many on the periodic table, and it was discovered many years ago that when people got it in the right dose, it dramatically lowered the incidence of cavities.
Okay.
If it's incorporated into the tooth. So if, say, a child is exposed to it when their teeth are developing, it will actually get incorporated into the enamel, like we were talking about, as chemically part of the enamel. So then that person will have a reduced incidence of cavities their whole life. It can also be helpful after that time period, but it's temporary. So like it's in toothpaste.
Okay.
It's in mouth rinses. It's in a lot of things these days. And so if you're topically exposing your teeth to it, they'll actually, like a sponge, actually soak up a tiny little bit of it, and it'll make that tooth more resistant to cavities for a period of time, a few days, a few weeks.
So let's talk about teeth grinding. That's bad.
It is, but at the same time, to some degree, it's normal.
Okay.
I mean, I think everybody grinds their teeth to some degree, especially at nighttime.
Sure.
You go through different sleep cycles, and it's totally normal to do a little bit of grinding here and there. Some people will do it way more than others and much harder than others. And so it can get to the point to where it can be a real problem. Yeah, I mean, I've seen people that have worn half, even more than half their teeth completely off.
And what do you do in that case? Then they have to be capped?
Oh, yeah. Yep.
Yeah.
They have to be built back up with caps or crowns or things like that, yeah. A really good preventative thing to do if you're starting to see the early signs of that is to get you into a night guard.
Okay.
Because there's really not much you can do about it at night. You're asleep. Of course, other people sometimes grind their teeth during the daytime, just out of stress. And that, just like any other habit, you just got to do your best to try to kick it.
So what's the most difficult procedure that you do that that is unusual, that you don't have happen? Like, you fill cavities and that kind of thing. You do root canals. That's pretty common, right?
Yeah.
Is there something that like tooth loss or something like that you have to, that's a difficult procedure?
All the procedures, the difficulty of them varies so much person to person. I think it's more about the given situation. Maybe a certain procedure on a certain person might be the most difficult or more difficult than the same procedure on a different person and a different tooth. You know, doing a procedure on a front tooth oftentimes is much easier than doing it on, say, a wisdom tooth.
Let's talk about wisdom teeth.
Yeah.
Why do they usually get extracted?
Well, the most common reason is just because most people don't have enough room in their mouth for them to come in properly.
And come in a little sideways or something.
Yeah, so what often happens is they end up getting kind of crowded out. They want to come in. That's what they were programmed to do. So they'll try to come in, but they'll come in maybe kind of halfway and kind of at a weird angle. And then that will make them really difficult to clean. Often they'll be, the majority of the tooth still submerged under the gum line, but they've broken through just enough to where germs and food and stuff can get under the gum, and that can lead to infection.
When do you usually see wisdom teeth start to come in? At about what age?
You know, it can be as early as 15, 16. I would say late teens and early 20s is probably more average. Every now and then, I have had somebody over 50 come in. It's almost always an upper wisdom tooth. And they'll tell me something's going on back here. I feel this pain. I don't know what's happening. Check it out. And I look back there and they're getting a wisdom tooth.
You would see that in an x-ray.
You can, you can see on the x-ray, but then also just in the mouth. I look in and there's just a little new tooth making its way through the mouth, just like I was looking at a kid who's getting a new tooth.
Well, we have a question from a listener.
Oh, wow. Okay.
This is from Toothless in Seattle.
Okay.
They want to know, if you had a bone graft years ago but never got the implant, would a bone graft have to be repeated?
Well, hopefully not. I mean, if it was successful and they were able to improve the quality and quantity of bone enough to where the implant could be done successfully, hopefully there's still enough bone there.
And how is the bone graft done? How do they do that?
Well, so artificial bone, and it can come from different sources. You can get cadaver bone that's been sterilized and ground up. You can get bone from animals, pigs and cows and things, same thing. Then there's also artificial bone that's just kind of a combination of all those elements we were talking about that teeth are made up of, calcium and phosphate and things like that, all just ground up into kind of a powder. It's like a coarse sand, and you basically just pack it kind of into these empty spaces where the bone should be and you want the bone to be, and you put the gum back over it and you stitch it up, and the body kind of utilizes that as a framework to start having its own cells infiltrate into the artificial bone, and it starts making bone out of it. And that can be really helpful if there's not enough bone. But getting back to the caller's question, if it was successful and they built the bone up as much as they needed to, there's a very good chance that there is still enough bone to place the implant.
And you'd want to replace missing teeth. Why?
Well, for a whole variety of reasons. But I mean, for one, extra chewing function. If you lose the tooth and don't replace it, teeth like to move. And so teeth on each side of the missing tooth will collapse into that space sideways. Teeth above or below it will migrate into that space. And then all of a sudden, things don't fit quite as well. They're a little harder to clean. And if you eventually decide you really want to get replaced, sometimes there's not enough space to put a tooth anymore, because all the other teeth have kind of collapsed into that space. One
of the questions that came in from Janae is coconut oil good for gums?
Well, that's the short answer is I don't know, and I don't think it would hurt the gums, but I do know that especially a few years back, I think there was a lot of hype about that on the internet, and they often referred to it as pulling coconut oil, and they would recommend. And I think the theory was somehow it would pull toxins out of your body, And I've heard stories, patients have told me that they've done this, and some of them say that they swish coconut oil in their mouth for up to an hour, which I
Really?
can't imagine. That's a really long time. But in general, I think the idea is the longer you do it, the more toxins it can pull out. I truly don't know if it works or not. But it is on the internet, like a lot of things are. I am almost positive it would not hurt you. But I don't know that it would help either. But it is a thing that's out there for sure.
Well, one of our volunteers, Tama, her daughter just graduated from OHSU in Portland, and she's a local new dental graduate, Dr. Rebecca Forshaw, and she worked with Dr. Bud Davies for a while, and she sent us some memorable questions that she gets asked, and some of them are quite funny, but one was quite good, and the question that she gets asked is, can you put one of my teeth in the back, in the space in the front? And tell us a little bit about this procedure and what you know.
Yeah, we got that list of questions that people had asked her on the break, and I was reading through it, and it just reminded me that, so that's actually called tooth transplantation, and it is not commonly done at all, or even talked about or taught in the U.S., but in other countries, it actually is. And so when I first graduated from dental school, I went to OHSU as well, and I was in the Navy for 4 years, spent 3 of them in Japan, and met several Japanese dentists when I was stationed there, and that was actually done quite commonly. The most common situation would be when a kid, maybe in their late teens, was needing to get wisdom teeth out, like we talked about earlier in the show, and they had already either been missing a further forward molar, or maybe there was a molar further forward that had become infected because of cavities usually, and needed to be pulled. So they would actually take the wisdom tooth. At the same time, they would pull the bad tooth, and they would insert the wisdom tooth into the tooth socket and stabilize it, and it, more than you'd expect, it would actually bond to the bone, kind of like an implant does, and they had a tooth. And so just a few years ago, I was at a dental lecture, and somebody was presenting on the fact that they had done that here in the U.S., actually just locally in the state here, where, a kid was either missing or was needed to have a front tooth pulled, was undergoing braces, and needed to have one of their bicuspids pulled to make some space for shifting teeth around. And they pulled the bicuspid, they pulled the front tooth, they inserted the bicuspid into the front tooth space and aligned it all and made it work. And then later on, they put a crown or a cap on it to make it look like a front tooth. It turned out beautifully. So it's something you don't hardly hear about at all in this country, but it is a thing elsewhere.
Wow.
And it can work. Yeah.
That's very cool. There's a lot of stuff happening in dentistry that just unheard of a couple years ago.
Yeah.
How do you get gum disease?
Well, there is all kinds of bacteria in our mouth. Lots of bacteria. There's no way to get rid of it. And a lot of it's healthy, normal bacteria. But some types of bacteria create toxins that really irritate the gums. And so if your gums get populated with that type of bacteria under the gum line, the gums can get really irritated. Another big component of gum disease, everybody to some degree produces calculus or tartar buildup. And that's what you're going to get cleaned off by your dental hygienist every however often you have that done. But that tartar will actually form little ledges, little shelves right at about the gum line. And so those bacteria creating those toxins will get under those little ledges and make it really difficult, almost impossible for you or I to clean. Mm-hmm. And so the gums just keep getting irritated more and more and more. As the gums get irritated, their response is to get away from the source of the irritation, which has become the side of your tooth or the root. And so the gums that were attached to the root will actually detach from the root. And as they start to essentially unzip from the side of the root, that distance, we call it a gum pocket, gets deeper and deeper. Of course, that bacteria that's causing it will migrate deeper and deeper, get harder to get to. And as that happens more and more, the bone underlying the gum will do the same thing. It will actually get irritated and start slowly dissolving away from the tooth, trying to get away from it. And eventually you lose the bone and the gum that are holding the tooth in.
So when you're in the doing an exam and you hear the numbers being done, 1, 2, 1,
there
2.
You go.
What is that? What are you?
We're measuring the gum pocket. We're measuring from where you would see the gum level to where it actually attaches to the root.
And so, what's a good number?
3
is a good number,
or less.
Oh, okay.
Is what we're looking for.
So you hear 1, 2, that's good.
1s, 2s, 3s are all good.
Those are all
4s
good.
are kind of the middle ground. They're not great. They're not horrible. 5s and up is when we start getting more worried.
So, ladies and gentlemen, if you hear 4 or above, you need to worry.
Yeah.
You need to talk to your dentist, yeah?
Absolutely. And something else to keep in mind about gum disease is it usually doesn't cause people really any pain until it gets into a very advanced state. And so if you're not currently, seeing a dentist somewhat regularly and having that checked out, it's something that is worth doing. Because if you can find it at its early stages, it's really easy to treat.
Okay.
But if it gets into its really advanced stages, it may be beyond even being able to treat, or at least be a lot more time and expense to get it under control.
Talk a little bit about dry mouth and what causes it.
Sure. Well, medication is probably one of the biggest, factors with dry mouth. If you look at the side effects of so many medications, I would say over half, they will list dry mouth as a side effect. And so that's one factor. Age definitely is a factor. As people get older, salivary glands just do not put out the same output. If anybody has ever had cancer treatment, radiation, chemo, that sort of thing, especially in the head and neck region, that can really dry up salivary glands. And so to combat it, there are these products called artificial salivas, and they're basically kind of like a gel. And so you just give a little squirt of this gel into your mouth and kind of swish it around, and it moisturizes the mouth, and it stays put for a half an hour, something like that. So, and of course the other thing you can do is just have a water bottle handy and take little sips every now and then.
Okay.
Yeah. But on that topic too, something to be really aware of with dry mouth, not only is it often uncomfortable and kind of irritating, but saliva is our number one defense against cavities. Our teeth are constantly being bathed by saliva, and that's helping to keep them clean. And when that doesn't happen, that plaque and bacteria and things that cause cavities stick on those teeth and they're not being washed off, it can put a person at a really high risk for cavities.
Okay.
Yeah.
Why does cold water make your teeth hurt?
Well, we going way back to the beginning, we were talking about what teeth are made of, and I kind of talked about the enamel and the dentin, and we kind of alluded to the fact that teeth all have nerves in them too, in the middle, and sometimes those nerves are more sensitive than others, but especially the most common reason I guess I see for cold sensitivity is when people have exposed roots on their teeth. So, and that comes, gum recession, that was kind of another aspect of gum disease. I didn't touch on that too much, but gum recession is when the gums that used to cover a portion of the tooth kind of wear away and they're not there anymore. And if some of that root is exposed, the roots don't naturally have enamel on them. And so that dentin that's exposed can often, it's just a little closer to the nerve, and the nerves feel that cold a lot easier. And the easiest way to at least start dealing with that is with sensitivity toothpaste.
Let's talk about why flossing is so important. And we talked off the air a little bit about those water picks, and you can go into detail about that.
Yeah, definitely. Flossing is important because you got to keep the whole tooth clean, and brushing just doesn't get in between the teeth. So floss, and the majority of problems that I help people deal with usually get started between the teeth, whether it's decay or it's gum disease. Those are kind of the two, big things we're dealing with most of the time. They usually start in between the teeth. And so I see people that brush their teeth really well, and their teeth on the surface look incredibly clean. But if they're not flossing, there's all kinds of stuff that can get started in between. So yeah, that's the reason for flossing. It is not a myth.
Well, and Dr. Gelder is my dentist, and what he tells me is use the floss that you like the best. If you don't like one type, try something else. Yeah. And I like those little floss sticks.
Mm-hmm. Whatever gets you in there and doing it.
Whatever gets the job done. Talk a little bit about how technology has affected dentistry and improved it.
Well, there's been, quite a few technological kind of breakthroughs throughout the years. In some ways, what we're doing now isn't a whole lot different than what we were doing 50 and 60 years ago. As far as the actual machinery, of course, the drills spin faster. They're more efficient. The suction, well, we get some people that actually say they prefer the old spittoon. But the suction we've got, allows us to see things better.
I remember those.
With
the water that constantly went around.
Exactly. Lasers are being used more in dentistry now. I actually have a laser in my office that I use for treating gum disease. Mm-hmm. Works really well. I see results with that absolutely better than you can get without it. And so, those are just some various ways. With root canals, they're always coming at so to do a root canal, you're removing the nerve inside the tooth, and sometimes those nerves can take some really tight turns and bends way up inside the root. It's hard to get to, and they're coming out with these really flexible but strong metals to go up and make files out of, to clean spaces that just 30, 40 years ago were not being cleaned. And so the outcome is absolutely better. So those are definitely some ways where technology is certainly improving things.
Is sugar the real cause of tooth decay?
Well, yes and no. So bacteria are what causes the decay, but their food is sugar. So essentially, when decay happens, it's bacteria. And again, we talked about it before. There's lots of different kinds of bacteria in the mouth. Only a relatively few of them actually cause decay. So there's a lot of bacteria in the mouth that don't. But if your mouth is populated with those that do, at a high concentration, you're going to be more susceptible to decay. And if you feed those bacteria sugar, then they're going to start eating away at your tooth.
Here's a question. Can the dentist really see signs of other kinds of issues in the body during an oral exam?
Well, there are certainly times where we can tell something's not quite right. But as far as knowing exactly what the problem is, maybe not as common. But we can certainly tell somebody this, something's not quite right. Have you talked to your primary care provider lately? Have you had, a physical exam lately? And kind of steer them in the right direction. Yeah.
Okay. How often should a toothbrush be replaced?
The standard, I think we often say, is about every 6 months. Okay. I think that really does vary person to person. I see some people that I think wear toothbrushes out even faster than that, and other people that maybe don't.
And you shouldn't be brushing too hard.
No, that Talk
definitely about that a little bit.
It'll clean the teeth well, but if you're brushing too hard, you can definitely start wearing the gum away. Getting back to that gum recession thing we were talking about. Mm-hmm. Yeah.
I kind of do that.
And the same thing with bristles, too. We usually recommend soft bristles.
Right.
Because harder bristles, again, you're going to clean the teeth well, but you're often going to damage the gums.
Well, my husband, Mr. Martini, called in with a question.
Okay.
And his question was, am I wasting my money on mouthwash?
I, in general, say probably. And what I tell people all the time about mouth rinse, mouthwash is if you like the way it makes your mouth feel, then use it. It's not hurting you.
Yeah.
But it also is not helping. And there's a lot of marketing out there through all kinds of dental manufacturers telling you it's just the greatest thing ever. But there really isn't any research or anything showing that mouthwash is going to do anything better or different
than water. Just rinsing your mouth with water after you eat.
And what really is going to keep your mouth clean is actually physical removal of the plaque, which is through brushing and flossing. Yeah. Water picks definitely have their place too. I recommend those quite a bit in addition to brushing and flossing. But mouth rinse, like I said, it's not going to hurt you. I don't think it's going to help you. If you like the way it makes your mouth feel, buy it and use it.
Are you listening out there?
Mr. Martini?
Mr. Martini? So what's the story behind the tooth fairy? We talked about this last year. Do you remember what we talked about?
No. And I don't know if I know the story behind the tooth fairy.
I asked you, what's the going rate for the tooth fairy?
Oh, yeah, it's going up.
We talked about that at length.
Inflation is a real thing these days. We all know about that. And I hear stories of kids getting $20.
No way.
Yeah. Yeah, $10, $20
See, and I thought
tooth.
a dime was a big deal. That's how old I am.
Yeah. No, I certainly was growing up in the era where it was coins, it was not bills. And I've heard some, in my mind, shocking numbers, but yeah, inflation, it is real and it's hitting all aspects of our lives. The tooth fairy, I don't know if she's going to go broke anytime soon or not.
Well, we're talking about inflation. Tell us a little bit, how has dentistry become so expensive?
Well, yeah, I mean, again, just kind of piggyback on that inflation. And, for a whole lot of reasons, inflation in just healthcare in general is so much higher than, just the average products. So, and it's been that way for decades. And, so every year it gets a little more expensive, even more expensive than everything else is getting. And it keeps climbing and climbing. But yeah, the materials we use are very expensive. The supplies, the tools, the retaining good staff, making it a good experience, the lab costs to make things, it all is incredibly expensive, shockingly expensive. And so, that's just kind of how it goes.
We've been talking off the air, and a lot of people are afraid to go to the dentist, Dr. Gelder, and one of the reasons is because of the cost. So talk a little bit about those kinds of things and how people can go to the dentist. First of all, you don't need to be afraid because they're going to take care of you.
We're always going to take good care of you.
That's right. They don't weigh you there. They give you a little gift when you leave. You get a toothbrush. You get a little thing of toothpaste. Well, you do with Dr. Gelder. I can't speak for everyone. But tell us a little bit about how you feel that people can afford to go to the dentist and get these things done. At least, teeth cleaning, very important.
It is. And, so we were talking during the break a bit. Before the song, we were talking a bit about, how dentistry has gotten so expensive and inflation and healthcare costs in general. One thing that we do at our office, and I think it's relatively common, is, we give discounts for paying cash. So that's one way to get the cost down a bit. I know one thing that I've been seeing a lot of lately that I think is actually driving the cost up a bit more is that we're seeing a lot of people signing up for private health insurance plans on their own. And I've seen it myself. I get the postcards in the mail at my house all the time, but there's been a lot of direct-to-consumer marketing from dental insurance companies selling insurance plans. And, it's kind of this common assumption in this country is, everybody needs medical insurance, everybody needs dental insurance. And they're really kind of a different product, but you don't need dental insurance if you have a job that's providing dental insurance for you, it's a great deal. Absolutely, take it and use it, and that'll get the cost down considerably. But if you're paying for the premiums yourself, all of these dental insurance companies are for-profit companies, and they have done a lot of calculations, and they're not giving things away for free. And so we've been seeing a lot of people take them up on these private plans that they're paying for themselves, and they come in and they start using them with us, and then they kind of start wondering, gosh, am I really getting my money's worth out of it? And we have done a lot of calculations for people to where we've shown them how much in benefits their plan has paid over the last year or two or so, and then they look at how much they've paid in premiums, and I can't recall one instance where they actually came out ahead.
Okay.
In almost all cases, they are paying more in premiums to the insurance company than they're getting in benefits. And so if you have insurance and your employer is paying for it for you, that is wonderful. But if you don't, there's a lot of, like I said, a lot of marketing these days. But I think in general, you're better off just going straight to the dentist and kind of eliminating that third party.
And I've been told that if you can't afford to go twice a year, which is preferred, at least go once.
Absolutely.
Go once a year, and remember to brush and floss, and then maybe that once a year is plenty.
And we work with people all the time finding creative ways to, maximize what they can do.
Right.
And there's almost always options. If you ideally should have a crown on a tooth, and that's really expensive, well, maybe we could do a filling. It probably won't last as long or hold up as well, but it's a lot less expensive, and it takes care of things in the short term. So there's always options.
Well, I just had a root canal, my very first one. I was terribly nervous about it, and I had a great experience. It wasn't bad at all. There's some
great.
drilling.
Yes, there is some. Yeah, not as much as some procedures, but yes, yeah.
Okay. Well, anything you want to leave our listeners with that we didn't cover today that you can think of, because you'll be back next year.
I am going to come back next year. It's been a good time. This is my second year, and I had a good time last year. This has been fun too.
Well, and what Penny told us was you were our very first person to be videoed on the air, and so this is our 1 year anniversary for the new video equipment.
And I haven't even tuned in and watched my videos. So
now you'll
it's
have
time.
to.
It's time to go to the website and check myself out.
Let me tell you how that's done. You just go to sequimfreeclinic.org, and the prompts will get you to all of the Working on Wellness forums, and the Working on Wellness Radio Forum is a health education program of the Dungeness Valley Health and Wellness Clinic. It's SQUIM's free clinic. And what does that mean to you? That means that if you don't have a care provider, if you are new to the area and you haven't found a doctor yet, if you are underinsured and you can't afford your deductible, if you don't have any insurance at all and you've got a problem, then let me tell you what to do. You go to the clinic, and Penny will remind me of the address, but they're open Monday and Thursday afternoons at 4:30. It's on a first-come, first-served basis, and they provide basic urgent care and chronic health care services to uninsured or underinsured community members, and they are located at 777 North Fifth Avenue, and you go kind of around to the back, and that's where the clinic is. And so it's a wonderful resource, and of course, if you'd like to donate to the clinic, you can do that by going to sequimfreeclinic.org, and you can see Dr. Gelder. And you can see Dr. Gelder from a year ago. You can see Dr. Gelder today, which will be up in about 2-3 weeks. So thank you very much for joining us, and come back again next year. And
looking forward to it.
I'll probably see you in July for my teeth cleaning.
Sounds good.
Or whenever it is.
Yeah.
All right. Well, thank you.
Absolutely. Thank you. It was a lot of fun.
All right. Well, one more thing.
Okay.
I just wanted to let the audience know that you can get a dental voucher as they're available at the Sequim Free Clinic as well. So thanks again for joining us.
Absolutely.
All right.